Hello, my name is Aurora and I'm a cancer survivor. And this channel is all about sharing ways to help cancer patients and survivors and loved ones heal from cancer with a little more ease and comfort. So if you like some of the tips I give, go ahead and hit the like button because it helps other people find the video. And if you want to get an alert the next time I upload something, just hit subscribe and then you'll know. So today I'm going to share some tips on dealing with hair loss and managing scar care and the types of laundry and personal care products that I've found the gentlest and most effective when it comes to dealing with these problems. So one of the first things people think of when they hear the word cancer is a bald person, someone with no eyebrows wearing a giant sweater sitting in the hospital. But that is not the case for every cancer patient. Not everyone that has chemo loses their hair. Not everyone that doesn't have chemo gets to keep their hair. There are different kinds of chemotherapy with different effects, and sometimes even if you don't have chemo, you can lose your hair just from being ill and the stress of illness and surgery. And some types of chemo, people don't lose their hair. One of my child's teachers shared with me that she also was a cancer survivor and that she had used something called a cooling cap in her cancer therapy, and it had allowed her to keep most of her hair. She lost a good amount, but with careful styling, it was enough that it wasn't really noticeable, and it was a really positive thing for her emotionally to be able to have kept her hair. And for some people, it's not, losing your hair isn't an issue when you have cancer or another illness, mostly cancer. It's kind of a badge of honor for some people. They just embrace it, they go with it, and it doesn't bother them. Uh, it bothered me. At first, I didn't really think a lot about losing my hair because the type of cancer I had, chemo wasn't going to be very helpful, so I knew that in my case I would just be having a lot of surgeries. However, I did end up losing a lot of my hair. I had huge bald spots, and giant gobs of it started coming out in the shower. I mean, like baseball size wads of my hair, and I have a lot of hair to the point where stylists will charge me extra to cut it. But I lost so much, even having all that hair, I lost so much that I had to cover up bald spots, and even my eyelashes fell out, and I had like a big gap in my left eyelid, but my right eye was fine. So it looked a little weird because for like a year I just had like the blank space over my left eye. So you can lose hair simply from being ill and stress and a lot of things happening to your body and different medications. It doesn't necessarily have to be from chemotherapy. So I did not use the cooling cap that my child's teacher told me about, although I did link what she told me about below. What she told me about was one of those, it's a cooling cap that's hooked up to a machine. So basically it's like those old hair dryers from the 1970s. If you're Gen X, you may remember being tortured like this by some adult in your family who wanted you to look nice for Sunday school, and yet they put in those horrible sponge rollers, or if your hair is like mine, they were just trying to like tame the frizz, and then they would put a shower cap on your head over the curlers or the big orange juice cans to smooth out the hair. And the shower cap had a hose that came out of the top of the head of the shower cap, and hot air would come from this case that was like a small suitcase. It had a machine in it, a hair dryer machine, and the hot air would blow through the tube into the shower cap, and it was absolutely miserable thing to use. Anyway, that's what the cooling cap that my child's teacher said she used was like, but it was apparently more comfortable than the 1970s hair dryer, even though it's the same concept. And she used it while she was having the chemo. I did not do that. Instead, I used basically an analog cooling cap, which is a cap you put in the freezer, and people use it for migraines, and it does work really well to get rid of headaches. I've had migraines for a lot of my life as well, and the cooling cap did help. So I would just put that on my head instead. And it worked for the headaches. I'm not sure if it worked to slow the hair loss that much for me. I think you might have to get the machine one that I link below, but I also link the analog below. I think for me it was a combination of things that I found that reduced the hair loss. So part of it was the cooling cap, and then I also found that using Nizoral shampoo seemed to help slow down the hair loss. And there are some studies about Nizoral helping to slow that down. If you've never heard of Nizoral, all it is a dandruff shampoo, but it's not. Head and Shoulders won't work because Head and Shoulders, the active ingredient is zinc, and in Nizoral, it's something different. So it has ketoconazole in it. That's a chemical in Nizoral, and ketoconazole is used to treat fungal infections and lower androgens. So it does help with male pattern baldness and baldness caused by seborrheic dermatitis. But there is some limited research that shows it can help with regrowing hair and with hair loss for other reasons. So I tried it. I thought that in combination with the cooling cap did work. But ultimately the hair loss just didn't stop until after the biggest and most complicated surgery was complete. So you could talk to your doctor and see if they recommend there are other treatments out there to regrow your hair after cancer as well, and to slow hair loss and balding. So you can ask your doctor about that. You can try the cooling caps. Try the Nizoral and see if it helps. I do think that it did help slow down the hair loss for me. Also, my hair did not grow back any curlier than it started. It grew back exactly the same, which is kind of, this is my hair. I don't get a perm or I don't curl my hair or anything. It's just kind of, parts of it are wavy, parts of it are curly. Some of it's just kind of a frizzy mess. It's a bunch of different curl patterns. It all came back exactly the same as it was before. Some people, when they lose all of their hair and then it grows back, they get what's called the chemo curls, and it comes back really, really curly. Nobody that I know has ever had that last. Is a temporary curl to their hair, and after about a year it goes away. So yours may grow back exactly the same, or it may come back with a chemo curl, but I've never met anybody that their hair stayed curly after it grew back from cancer. And by the way, no one's paying me to say this. Like, I'm not sponsored by any of these companies. I don't have a Amazon storefront to get a commission from anything. This is all stuff that I actually use, that I actually feel like works really well, and that I do recommend for people that have sensitive skin and that also want a product that works. So I don't get anything out of it. It's just I used it and it may help you too. Um, so the last thing I want to talk about is scar care. And there is a lot of information out there about scar care, and not all of it is very realistic. In fact, a lot of it is not very realistic. Putting silicone gel and patches on scars is kind of a gold standard of scar care, and that's what everyone tells you to do. However, I found that a couple of things about this. One, the gel gets all over everything, no matter how hard I tried not to get the gel on everything. And the patches for the silicone scar patches have an adhesive on them that if you have sensitive skin, and especially if you're allergic to glue like me, you can't really use them. So I couldn't use the scar patches because it just made me like get red and itchy and blistered. I have used the Silogen gel, and that is supposed to be the best, and Silogen has been given to me by surgeons. But to be honest, even when I either powered through the adhesive rash or used the gel and dealt with the mess, it didn't help anything. It did not make a bit of difference on my scar. I have scars that I have used it on and that I haven't. It just really did not help at all. The best way to get a nice, thin, flat, white scar is to get a really good surgeon and to have a very good healing process. And that's pretty much it. If you don't have those two things, the amount of products out there that you can apply to the scar are you're just not going to really find anything that's ever going to replace having a good surgeon and a good healing experience. For me, on my upper body, I had that. I had the ideal, like, pencil thin white scars that will respond well to some laser treatments, and they will be mostly invisible. It'll be fine. My legs, however, totally different story. I had a very bad experience with my leg scars, which go from my knees all the way up to my hip. And I had a bad experience with something called a wound vac, which is what it sounds like. It's a vacuum that closes the wound because they can't get the skin to stitch together. And I won't go into the whole story here, but it was very painful, and I was left with 18-inch long scars on each leg that were 2 inches thick in some places. Like, the scar itself was like that wide in some places. It was a mess. I've had to have 3 revision surgeries on those scars, which has gotten them down to being nice and thin and flat. But it was the revision surgeries that fixed the scars. It wasn't any gel or anything else. So I know this sounds pretty depressing and terrible. Like, why am I sharing this with you? I'm not trying to depress anybody, but I think it's important to set expectations. If someone's telling you, yeah, you're going to have these massive scars, but you just slap some gel on there and it'll all be good. Realistically, no, that's not true. I ended up having to have some scar tissue surgically removed because it was impeding movement. It was impeding mobility. So if you find yourself in this situation with really large scars, do not be surprised to find that the area around the scars is hard, almost like a rock, and that it will take about a year, and in some spots even more, for that hard tissue to soften up completely, and for the internal scar tissue, because whatever you see on the surface of your skin, there's much more scar tissue beneath that. It'll take a while for that to completely integrate into your muscles. Do not skip any of your post-op visits, because those will be key in getting that scar tissue in hand. You may be referred to a dermatologist to work on keloid scars, but usually the insurance won't cover that. Sometimes they do, but the most insurance-friendly solution and the most effective solution, if you do not have a great healing process and you end up with big thick scars, is to get the surgeon that did the surgery to go back and do a repair on it. That's the one the insurance is most likely to cover, if the surgeon themselves goes back and does a scar revision. So in recovering from all of this scar nonsense, I have found that there are some things that do help to heal the scars, even though they won't necessarily reduce the size of them cosmetically. They'll help to heal them. And one of those is red light therapy. So it has to be the right kind of red light in the right level. So I have linked below the panel that I got to use on my scars, and it has all of the right settings and the type of wavelength that you need. And this was recommended to me by a dermatologist and by one of my surgeons to go ahead and try this red light panel. And I think it did help the scars to soften up. It helped the internal scars because red light penetrates past your skin. It did help them to integrate more into the muscle. It softened everything up, and it helped everything to heal faster. I also found that the surface of the scar area softened up and felt better and had more mobility, and I think it helped with the redness a little bit. was using a vitamin C body serum and a vitamin A and E oil. And I've linked below the 2 brands that I used. You could use any other brand that's more expensive, less expensive, more comfortable with, you like the scent better, whatever. But having those vitamin oils did help. And so after I did the red light therapy and put on the oil, I would just seal everything in with a hypoallergenic, unscented lotion like Aveeno, something very that you can just buy at Costco, very inexpensive but effective. And I would just put a lotion on top of that. So in addition to the red light and the vitamin oils and the lotion, the other thing that's you will need no matter what happens with any of your scars or how beautiful they look, you'll need sunscreen. I am pale, but I'm not a person that burns exclusively. I will tan, but scars were a whole new experience for me. They burn worse than my skin. And you do need to have, even if you have skin that it doesn't burn and you're not worried about it, and you're the type of person you've got like SPF 15 and you're good to go. I recommend getting a 50 SPF 50 for your scars, because they can burn and it does hurt more than your skin. And I was surprised by that, but especially in the summer, definitely get sunscreen for your scars. So that's some tips on wound care, scar care, and I hope that you all have wonderful surgeons and wonderful recoveries and beautiful scars that are your battle wounds that you're proud to show. And remember that you kind of won those scars. They show how tough you are. And so no matter what, you are beautiful. And I wish everybody a healthy, happy, wonderful healing journey, whether your scars are from cancer or from some other surgery. And I will be back in another video with some more tips. So until then, stay hopeful and take care of each other.